Everybody, I got a few questions about Botox, what it is, how it works, and why we use it. So I wanted to quickly just do a few minutes about what that is and answer those questions. So Botox, first off, why do we use it? In the realm of cosmetic surgery, the reason why we use Botox is to relax the muscles underneath the skin that are causing wrinkling or lines that we don't like. So the common areas that we treat for Botox are here in the forehead, so the glabellar area. You get these vertical lines here and typically a horizontal line here. Also the forehead, when you raise up, you get these lines across the forehead that people don't like, as well as the crow's feet here around the eyes. You can get lines and wrinkles there. And so the lines are being caused by the muscles underneath that when they contract, they're actually pulling the skin and causing some lines. Now this is different than other areas of the face like the nasolabial folds or down here in the marionette lines. Those are actually being caused more by volume loss, and so instead of using Botox, we use fillers. And so we can replace volume with a filler. And that can get a little confusing for patients because they think, why are we using Botox some places and filler in another place? Well, the real reason we choose one or the other is it's either a volume loss problem, we use filler, or if it's a muscle that's being caused or is the cause of the lines, then we'll use Botox to actually relax the muscle and stop that from happening. So the question is, what is Botox? So Botox actually comes from a specific bacteria and it creates a toxin. That toxin actually stops the muscle from contracting. And the way that it does that is that there's a signal that gets sent over to the muscle, and the muscle needs to get that signal for it to contract. Well, Botox or botulinum toxin actually stops that signal ever from being sent. And it does that permanently, actually. So when you give Botox, there's actually no way to reverse the effects of Botox from what you give. But the good news is that in 3 to 6 months, the body regenerates new signal generators. And so it's not permanent. Your body will make new signal generators and the muscle will start working again. However, it is a nice effect to be able to stop those lines from happening for a period of around 3 to 6 months. And you can get retreatments. And over time, the idea is that you would be using less and your body will have a better response to it and softening those lines over time. So Botox in general, Botox is the main name of the main brand of botulinum toxin. It's made by Allergan. There's also 3 other types of Botox that are just different brand names, all of botulinum toxin A. So there's Botox, Dysport, Xeomin, and Jeuveau. So all those names are doing the same kind of mechanism of action, how it's stopping the lines from happening. And the last thing is, so how is Botox given? What's the treatment like? Here you come in for a consultation. We'd go over the same amount of information of how it is or how it works and why we're giving it. Then we'll target those areas and see how strong those muscles are. And then we'll drop some Botox, and it is injected through the skin through very small needles. I like to use a nice topical anesthetic that does a really nice job of numbing the areas. The injections are pretty painless. And once the medicine is injected right underneath the skin, it diffuses in and it affects the muscles. Effects are started to see a couple days after treatment, and full effect about a week or so. And then if there's still some residual areas that need touching up or treatment, you can always come in 2 weeks later and we can do that. And really restrictions after Botox treatment, there really is almost none. You can go back to work and do your normal life and normal routine. The only thing we want to do is make sure you're not putting your head down between your legs or anything, putting your head in reverse, just because we don't want to have any of that Botox potentially travel to areas that we don't want, specifically the upper eyelid. Sometimes there's risk, very, very low chance of it getting into the upper eyelid and causing some ptosis. And other risks that can happen from Botox that are important to know. If you treat the forehead in a way that is not good for the eyebrow position, you can get some arching laterally of the eyebrow, which makes you look surprised, or it can make you almost look like a Spock look on the lateral part of the eyebrow. But as long as you go to a well-trained person who has experience doing Botox injections, you're going to get some really nice results. And if you have any more questions, please let me know, and thanks for listening.